Hi there. I'm sure you know the kidneys are an organ found in the body. Did you know the kidneys are just like any other body part and may become dysfunctional? Therefore, what happens to a person who has a dysfunctional kidney? They have a kidney disease or they have their kidney injured. Are they left to die after they are involved in that accident or they develop that kidney problem? This is Z Online School, and in this lesson we'll be looking at how different ailments of the kidney are treated. By the end of this video, you will be able to know the sources of kidney ailments, how kidney transplants are done, kidney dialysis, and some study tips you should be able to remember when thinking about these treatments. There are basically two sources of kidney ailments: sources leading to kidney disease and sources leading to kidney injury. There are four sources leading to kidney disease. The first is inflammation of the glomeruli, which are some structures found in the nephron. If you don't know what they are, you can check out our video talking about how kidneys function. What might also lead to kidney disease is the inflammation of tubules. You can also check out the video under kidney function to know where the tubules are found. Genetic kidney disease might also be a source of the kidney disease. What this is just if your family has got quite a number of people with kidney disease, it means some other offspring or some other children might have the probability of having a kidney disease. Last but not the least, what might lead to a kidney disease is urinary tract being blocked. Urinary tracts include the ureter and the urethra. If these are blocked, the kidneys might fail to excrete the waste that they make. And therefore, this might lead to the kidney having a disease. You should remember those wastes are toxic. So if they are kept in the kidney will be affected negatively. What are the sources that lead to kidney injury? The first is low blood flow to the kidneys. This low blood flow may be due to the overuse of drugs like ibuprofen and aspirin. These drugs are usually pain relievers, so if they are used too much, they might cause your heart rate to fall down. And when that happens, even the blood flow towards the kidneys might reduce, and this might lead the kidneys to get injured. Intake of toxins like alcohol, cocaine, and heavy metals might also cause the kidney to get injured. This is because the kidney will begin to overwork. Last but not the least, direct damage through impact through usually accidents can cause the kidney to be injured. We're going to first define what kidney transplants are, then look at other things about kidney transplants. If you look at the word kidney transplant, you agree with me that it has the word transplant in it. So if we were to find the definition of transplant, it would be very helpful for us to understand what a kidney transplant is. To transplant means to take an organ, skin, etc. from a one person, animal, part of the body and put it into or onto another. So let's say you get an organ, which is the kidney here, from one person and then put it into another. Then you have transplanted a kidney. Or let's say you take a skin from a person or an animal and put it onto another, meaning you've transplanted the skin. Now, under kidney transplants, we should be able to notice these words donor and recipient. Donor meaning a person from which a kidney is taken, while recipient, a person who is receiving that kidney. Therefore, kidney transplants are surgical operations in which a healthy kidney from a donor is put into the body of a recipient. This is a very simple definition. You shouldn't have problems to remember it. A surgical operation in which a healthy kidney from a donor is put into the body of a recipient. You should note the following about kidney transplants. For a kidney transplant to be done successfully, the donor and recipient tissues must be compatible, meaning they should be able to be put together. If the donor gives a kidney that is not compatible with the recipient tissue, there will be tissue rejection. Therefore, the kidney won't be able to work in the recipient's body. Another thing you should note is that before a kidney transplant is done, the donated kidney is screened for any diseases. Kidney transplants have got several advantages over kidney dialysis. The main advantages are that the recipient can lead a normal life. If we look at the disadvantages of kidney dialysis, you come to understand why this is an advantage of kidney transplants. The recipient does not spend hours doing dialysis. Another advantage is that there's no need for them to closely monitor their diet. People who've undergone kidney transplants are also not worried about going to the hospital once again to undergo another session of dialysis. There are some disadvantages of kidney transplants. The first one is that whenever someone needs a kidney transplant, they need to undergo a surgery or an operation. Another disadvantage is that the recipient has to wait for the surgery date to come. If the surgery date has not been reached, the kidney transplant might not be done. Therefore, if you are in a very critical state, it's very bad to be waiting for a kidney transplant when you are about to die. Kidney transplants might lead to the donated kidney to be attacked. Therefore, you have a risk of that kidney not being accepted by your body. Last but not the least, the recipient is required to take immunosuppressive drugs, which are drugs that simply lower the power of your immune system, and therefore sometimes people who've undergone kidney transplants might have a weak immune system, therefore they might easily get sick and things like that. Another common way of treating kidney ailments is kidney dialysis. There are two kinds of kidney dialysis. However, in both of them, the treatment involves filtering of blood using a machine. The first kind of kidney dialysis is peritoneal dialysis and hemodialysis. Hemodialysis is the kind of kidney dialysis usually that will be examined under the ACZ syllabus. Under peritoneal dialysis, we've got an abdominal cavity or an abdominal space, which is called the peritoneum. This peritoneum has got blood vessels around its wall. Therefore, it saves a good place of exchange of the toxic waste into the dialysis fluid. As you can see in the diagram, we've got a tube that's inserted into this cavity known as the catheter, which will be used to discharge and put dialysis into this space. The process by which the dialysis is put into this peritoneum and taken out is known as an exchange. However, this kind is not focused much on under the ACZ syllabus. We've got hemodialysis, which is focused much on. This diagram shows how hemodialysis takes place. This diagram is illustrative, so if you can see the labels clearly, you can just pause the video and read them. However, if you can't, what happens in the hand is that the dialysis machine is connected on the same blood vessel where a branch is made out of the body to supply blood into this dialysis machine, and another one from the machine to bring the blood that has been filtered into the body. If you can see in the diagram, there's a small connection that has been made between the artery and the vein. This connection is added so that the blood can enter the vein and then be withdrawn for dialysis. As we go towards the dialysis machine, we've got a pump. This pump helps the blood move at a speed that is higher than the dialysis fluid. Therefore, the flowing of blood in this speed that is high will cause faster diffusion. At the other end of the dialyzer, we've got a filter which ensures there are no other particles that are entering the blood. At the right and left part, we've got one side where the dialysis fluid is coming in and the other where the dialysis fluid is going out. You should note that the blood usually will have a higher concentration of urea, water, and salts. Therefore, these unwanted substances that I've just mentioned will flow down a concentration gradient into the dialysis fluid. Therefore, you should note that 1. The dialysis fluid must have a same glucose concentration. If there's no similar or equal glucose concentration in the blood and the dialysis fluid, what might happen is that the glucose might move from the blood into the dialysis fluid, therefore leaving the blood with very little glucose. And we know glucose is very essential for processes in the body to occur properly because glucose is used as energy. Therefore, if there's low glucose, there will be no energy to do many processes in the body. You should also note that the dialysis fluid must be around the body temperature, which is 37 degrees Celsius. If this is not the case, the blood might begin to clot. We've already talked about the last point you should note, which are just the substances that move down the concentration gradient into the dialysis fluid. Now we can look at the advantages of kidney dialysis, specifically hemodialysis. The advantages of hemodialysis are kind of linked to the disadvantages of kidney transplants. Therefore, you see some related ones. Unlike kidney transplants where you need a donor to give their kidney, this advantage is just simply telling us for hemodialysis, machines are widely available. There's nothing like worrying about someone to donate a kidney. Next is that the patient does not need to be operated. They're just minor cuts done into the skin, just simply like a person on a drip in the hospital. So they are not very much big of cuts made into the skin. Next, we've got the advantage that the person who's undergoing hemodialysis does not need to be waiting. If you can remember, someone who's undergoing a kidney transplant needs to wait for their surgery date to come. But for someone undergoing hemodialysis, there's nothing like that. Dialysis machines are widely available, so they just go to the hospital and the dialysis is done. Kidney dialysis also has disadvantages. The following are the disadvantages of kidney dialysis, specifically hemodialysis. Patients have less freedom to move around. Because of the tight schedule with the hospital or the dialysis center, a kidney dialysis patient will usually have less time to move around. The patient spends hours on the dialysis machine, so this affects generally how their day goes about. A patient undergoing hemodialysis needs to minimize intake of some food, so they become a bit selective on what kinds of food they are supposed to eat. With that said and done, finally we have reached our study tip section. The first study tip we're going to look at is the common diet restrictions given to a dialysis patient. They are not hard to remember. They're just 3 kinds of contents found in food that a dialysis patient must stay away from: high sodium, potassium, and phosphorus. Sodium is not good for this dialysis patient because it will give them excessive thirst. Potassium is not good for them because it will lower their pulse. And high phosphorus is not good for a dialysis patient because it increases the rate at which calcium might be drained out of their bones. Foods that contain high sodium include sausages, ham, bacon, and canned foods. Canned foods might include canned meat and canned fish. High potassium foods include legumes, for example, peas and beans. High potassium foods also include juices like orange juice and grape juice, while foods with high phosphorus content include pork, chicken, rice, and oats. Another thing you should note when you are thinking about kidney ailments is that sometimes heparin might be used during dialysis. This is as to prevent the blood from clotting in the dialysis machine. So heparin might be sometimes referred to as an anticoagulant. Last but not the least, you should be able to know the importance of countercurrent flow. Countercurrent flow is just simply the mechanism by which the dialysis fluid is made to flow in the opposite direction to blood. This is important to increase the rate of diffusion. The other kind of flow is concurrent flow, where the blood and the dialysis move in the same direction. This has got a low diffusion rate compared to countercurrent flow. In countercurrent flow, it's like the dialysis fluid and the blood are colliding. Therefore, there will be a higher rate of diffusion of those substances that are not needed in the blood into the dialysis fluid.